All right, I see Kim's turned on the recording, so I'm going to go ahead and get started, if that's okay with you, Raj.
Yeah.
Okay. Hi, folks. This is Don Guadagnoli. I think I've met many of you over the years. Tonight, we're fortunate to have with us Dr. Raja Sinjab, who is a holistic trauma therapist and is the co-founder of Realize Truth Incorporated. This is part of the series that Dr. Siddhartha has put together around health equity and wellness. And I'm going to turn it over to him in a second, but a little bit about Dr. Sinjab. She got her bachelor's degree in psychology from UMass, and then went on and got a master's in mental health counseling with a specialization in art therapy from Lesley University in Cambridge. She then went on to get her PhD in counseling and psychology and is on the adjunct faculty at Lesley University, as well as being a licensed mental health counselor, a registered art therapist, and a yoga instructor. She'll be talking tonight. I think you've all seen the title of the talk tonight. And I'm going to turn this over to Dr. Siddhartha for a sec to say a few words, and then we'll move on to the program.
Thank you, Don, and thank you, Dr. Sinjab. For the group, I just want to frame it up to say that one of the efforts we're working on for health equity in Cape Cod Healthcare is to identify any disparities and then address them. And one element we are working on is on high blood pressure disparity and preeclampsia disparity. So we find that in our data for Cape Cod Healthcare patients, we have a higher proportion of uncontrolled hypertension among Black patients we have, and then preeclampsia also higher among Black moms, twice the rate that we see. So one of the approaches there is to understand and make referrals for patients that we come across when we see that they have chronic diseases, including hypertension, and there's a history of trauma, or a potential for that, to explore more on that angle and to have resources on trauma therapy. So this is to make sure that when we are seeing patients, we can have a source where we can refer to for specific elements of trauma therapy that Dr. Sinjab will talk to. So I will pause there and hand it over to Dr. Sinjab. Thank you.
Thank you so much for both of you, and thank you for having me. It's great to be here tonight. Such a beautiful day today. And I'd like to really acknowledge that these topics are difficult and it's a big discussion, but I'm hoping that we can delve into it as best as we can. So I'm going to share my screen. So the topic tonight that we're going to explore is the comorbidity of intergenerational and historical trauma and health disparities in people of Black, Indigenous, and people of color. I did my PhD doctoral research on intergenerational trauma and historical trauma, and this is something that is sort of relatively new to the field within the past 10 years. So this information that I'm bringing you is the most current of our time. The key learning objectives for tonight, defining the physiological and emotional effects of historical and intergenerational trauma, including effects on chronic illnesses. Number 2 is discussing neuroscientific evidence on current methods of trauma counseling. And finally, identifying evidence-based practices for trauma treatment with mind-body integration techniques and community-based healing. So there's a lot to cover, and I'm hoping that we can thread all of these things together. My disclosure statement, I am the co-founder of Realize Truth, Inc. It's a nonprofit here on Cape Cod that me and my husband have started for holistic mental health services, specializing in trauma. And as such, I am a recipient of the dividends of the work within the company. So this is fully disclosing. So let's get into it. What is intergenerational trauma? It is the transmission of trauma experiences and their psychological and physical effects passed down across generations through families. So when we think about somebody that has experienced a traumatic event, they are going to change their genetics and their behaviors based on that event. And it will be passed down to the next generation. And it can also continue to be passed down to the next generations. This might look like a family trauma history in clinical terms, but it's a little bit deeper than that. The physiological effects of trauma include when stress is activated and increased, the hypothalamic pituitary adrenal axis within the limbic system is activated. So this means that there are cortisol hormones being pumped to increase the activation of the body. We're running from the lion. We need to get away. So that stress is activating the sympathetic nervous system. And from continued overactivation by traumatic experiences, it has been linked to anxiety, depression, difficulty concentrating, memory issues, addiction, aggression, antisocial, and avoidance behaviors. So a whole slew of mental health symptoms can come from this. A lot of times when someone will go to the doctor, go to a therapist, go to the ER, they're presenting with these symptoms, but underlying is the overactivation of the nervous system that's taking place. The psychological effects of trauma have been associated with decreased gray matter of the orbitofrontal cortex. So let's just pause to review what the orbitofrontal cortex is. It receives information about the sight of objects and integrates thoughts, emotions, and motor responses into coordinated goal-directed behavior. So that's a lot that the one part of our brain is responsible for. And trauma is going to decrease its activity, which means it's going to damage the ability to have decision-making, impulse control, executive functioning, problem-solving skills, and emotion regulation. These are major things in the mental health field. When someone is presenting with some type of symptom that they're going through, this is the orbitofrontal cortex could be impacted as a result. When we think about the presentation clinically of when someone comes into the ER, the hospital, the doctor's office, the therapist, they're going to be labeled with these presenting disorders, right? Because they're going to have certain symptoms, depression, anxiety, and underlying that is really the overactivated nervous system from the traumatic event. So rather than just labeling PTSD, a lot of times people will be diagnosed with these other disorders that surpass the root of the problem. And that can get tricky with people's identity. So the disorders that people are experiencing underneath could just be a traumatized event. What's important from that point is that a family member can go through a traumatic event and then pass it down through the genetics and through their behavior. And it could be the child being labeled with those disorders. And now instead of it being connected to intergenerational trauma, it's going to be labeled as a disorder and impact the child's identity development. It's notable that in early childhood trauma, the effect of the HPA axis, stress response regulator, and the BDNF codes of neurotrophin are linked to neuroplasticity. So BDNF and F is a protein in the brain and spinal cord that helps nerve cells grow and mature. Key factor in the development of plasticity in the brain is involved in many important functions. Neuroplasticity is the ability to make new pathways in our brains. Traditionally, in the past, there was a set knowledge of belief that we could not change our brain. We had this depressive disorder. It was for life. We can't change it. Our neural pathways are set in stone. And over the course of time, more recent years, due to neuroscience research, we know that we can change the neural pathways. We don't have to stay the same. Our brain can morph and transform through different ways. Early childhood trauma does affect the ability to make those neural pathways. And this suggests that childhood trauma solidifies stress response patterns and makes it neurologically more difficult to rewire and potentially adapt to new ways of thinking and behaving. So when you think about somebody that has experienced early childhood trauma, there's a lot of quote unquote resistance there. They might not be adapting to the treatment plan suggestions, or there might be some treatment resistant therapies or pharmacological interventions. Maybe the medication isn't responding. And it's because the childhood trauma has solidified these stress patterns so deeply that it's hard for the brain to create new neural pathways. So when we think of someone that might be really difficult and not trying, that's sort of like the label that happens sometimes in the system. It might be because their brain just cannot create it as naturally as someone that had a secure childhood. Historically, we have thought it's nature or nurture, right? It's either we're born with this or it's because of our environment having a good enough mother. And that was sort of the take in the past. But research is coming into existence of epigenetics. And epigenetics is the idea that our genes are suppressed and expressed because of our environment. So our environment is what is creating the genes to come out. And it's both, it's nature and nurture. So research has identified that the transfer of parental experience of trauma can be transmitted through intrauterine signaling, breast milk composition, breastfeeding behavior, and patterns of parental care known as attachment styles. So it's the way that caretakers are taking care of their children, and children are learning behaviors through the caretaking, but also it's the genetics that are being expressed from that caretaking. Notably, there's a book where this really started to all come out, and it's called It Didn't Start With You. And the author talks about how the research on mothers have shown that they're carrying eggs, and those eggs are carrying eggs. And so for 2 generations, a woman is carrying the eggs that are going to be genetically impacted. So a mother goes through a traumatic experience, altering the stress response in the body and signaling to a different gene composition for the eggs, and those eggs, then that's 2 generations that are being altered there. That's a long pattern, a long family pattern that's being established. So there's all these ways that the environment can interfere and activate the gene expression of development. And Jared Cass actually notes this as the chain of pain. So the chain of pain is continuing the cycle on and on through the generational trauma. The epigenetics, which I touched on before, is defined as a science which examines the expression or suppression of genes based on environmental exposures. So this is the traditional biomedical model focusing on nature, and usually it's medication interventions for that approach. So someone will go to the doctor, I'm feeling sad, I'm feeling depressed. There's a prescription of antidepressants written, and maybe there's a referral to a therapist. Not always, a lot of times there's an access to a therapist. But the nurture part is talk therapy. So it's working with someone to work on bettering your life and your cognitive development. And this is the traditional model. If we sort of switch gears a little bit, and we think of intergenerational trauma as the family patterns being passed down. So someone in the family line has experienced trauma and they're passing it down, and eventually it looks like a disorder, whether it's depression, anxiety, or all those other disorders that were listed previously. Now, if we think on a macro level scale, the historical trauma also plays a huge factor in people. So historical trauma acknowledges groups of people who have been oppressed by other groups of people. And this looks like slavery, Holocaust, forced migration, violent colonization, and war. And I want to notably put in famine and natural disasters. That's not in the definition, but I think that those things impact on a large scale also, and they're worth mentioning. So we're currently seeing a huge impact of historical trauma happening in the world right now, and the ramifications of that may take years to really fully understand what's happening. The social ramifications in our country have turned into classism, racism, and sexism. So groups have oppressed other groups, and it has turned into these systems that marginalize people. If we think of a theory that navigates this a little deeper, it's called post-developmental theory. So there are 3 stages of historical trauma being passed down. A mass trauma experience for marginalized people takes place when a dominant group subjugates a population. So a group is overtaking another group. And then trauma responses happen in that first generation. The people that experience the oppression are being traumatized. The trauma is ultimately transmitted to the next subsequent generation through learned behaviors and epigenetics. So it's going to continue to be passed down, just like the intergenerational trauma, but this is more on a macro level and a group level, not just on a family-based level. An example of this is colonization of Indigenous people and Black enslavement in the past forced families into poverty. And poverty results in prolonged stress, affecting depression and cardiovascular health in women. So the poverty was the result of the historical trauma, but it has a lasting impact of strain on the physical and mental health of that group. And then the toxic stress from being in poverty alters the biomarker genes passed down to children, which are reinforced by the environment due to distressed parents. So it just continues because the environment has distressed parents, and then that is going to express the genes of that have been genetically altered through the trauma. So that's how the trauma can just continue to keep getting expressed throughout history, really. This oftentimes looks like defiant children, right? So the lack of emotional regulation skills, maybe because of the gray matter in the orbitofrontal cortex, could potentially be seen as defiant behavior rather than the result of historical trauma, and places the blame on the child rather than the systemic event. So we kind of think of historical trauma events as things of the past. They're not really impacting us right now. They were long ago. We've made, rectifications, and we're trying to be more progressive. But the body is still recognizing this distress because it hasn't fully healed. And it's just continuing to be passed down through the next set of generation. And it looks like toxic stress. So toxic stress is a physiological effect of intergenerational and historical trauma. And it occurs when prolonged trauma overactivates the body's stress response, increasing the risk of cardiometabolic disease, gastrointestinal disorders, learning disabilities, mental illness, obesity, and substance use. All these things are linked. So we can see someone that's presenting with any one of these and start forming a lens of, is this linked to something deeper? Is this because the central nervous system is completely overactivated, and it has been for their entire lives, their entire family line, right? This could be happening for decades. So toxic stress becomes an indication of a health disparity of high blood pressure in Black, Indigenous, people of color individuals, and it's linked to the histories of their trauma. Resmaa Menakem, who has done immense work, discusses that racial injustice does not only live in the minds of Black people, but in the bodies. And I really love this quote because we think that it's something that we can think ourselves out of, but our bodies are still remembering, and they're feeling things, and we've been disconnected from that. And he identifies the term traumatic retentions, describing the tension between survival behaviors that may be contributing to historical and intergenerational patterns. So if we think of survival patterns, survival behaviors, it may look like somebody that is getting into gang fights in the streets, right? It may look like somebody that is completely isolated and shut down. Those are both protective mechanisms that may have been needed in their family line at one point that was taught to them. And they've adopted as a survival behavior, but it's now working against them in this current society. So they're looked at as negative behaviors, but they're actually, what he's saying is they're actually behaviors of resilience, because they were ways of living that needed to happen to get to this point. If they hadn't acted in those ways to protect themselves, they wouldn't have survived. Their family line would not have survived. But now the body is continuing to think that it's still in that sense of danger and threat and needs to continue the acts in order to survive. And maybe some marginalized people are still in a unprotected area or in unsafe environments that they do need to continue to have survival behaviors. But then that results in, other systems getting involved, law enforcement, the mental health system, a number of things. So the body is remembering, and trauma is stored in the body. We used to think that it was just a cognitive process, and Bessel van der Kolk did a lot of research in the past 20, 30 years, and he's a psychiatrist from Boston, and he has really acknowledged that trauma is stored in the connective tissue, in the fascia and muscles in the body. And healing trauma means getting to the root and releasing the muscle memory. So research has indicated that talk therapy cannot access the traumatized brain. It does not address stored trauma in the body. If we think back to the body is being overactivated, the HPA axis, the sympathetic nervous system, all of these processes are heightened because of the threat of danger, and they're being passed down through the generations. Why would talking about it alleviate the stress that's being built up in our body, the cortisol that's being constantly? That's why there's a baseline of anxiety that we see in people that that are feeling the effects of this unresolved trauma. So if we shift from that traditional lens of the biomedical model and talk therapy, and we start thinking about an intersection between the two, nature and nurture, we need to acknowledge the body-brain connection. Our body is experiencing something, and it is feeling, and our mind needs to acknowledge what the body is feeling. A lot of times I talk to people that have experienced trauma and tell stories of horrific events that they have gone through, things that you wouldn't even imagine. And they're telling me as if they were talking about what they ate for dinner last night. And it's very nonchalant, it's very matter of fact. This is what happened, I was this age, and it really just becomes like a programmed story. And, Bessel van der Kolk talks about this, that the traumatized individual creates a story, a narrative for themselves, because they cannot emotionally connect to the horrific events that have happened. In order to heal, it's bringing the body and brain connection together. I also want to point out family therapy and a supportive community is also necessary. Those are usually left out and their systems sort of like after the fact, but they're extremely important in the deeper healing process of trauma. Just to go one step deeper, the neurons of neurons, the limbic system is an area of the brain that creates emotion and memory. And within that is the amygdala, and it controls fear, rage, and anxiety. Area is an area of the brain that navigates production of speech in the frontal lobe. It's related to decision-making logic. When trauma occurs, there is a breakdown between thoughts and speech. So the Broca's area is not able to be accessed when a traumatic event is happening. It shuts down in order for the more primal responses of fight or flight to take place. And so what does this mean? Why is this important? Trauma cannot be processed verbally. And it becomes a major barrier to traditional interventions, because what we're taught in school in these talk therapy settings cannot activate or integrate into the healing modalities of trauma. And what we're learning is something else needs to take place. Historically, we've been trained to treat symptoms of trauma through medication management and talk therapy. But what do we need to be focusing on? The body needs to learn that it is safe. How do we do that? Neuroplasticity and resetting the nervous system. We just learned that the nervous system is chronically overactivated into a toxic stress experience, and that neuroplasticity, the ability to create neural pathways, is more difficult for people that have experienced childhood trauma. So it takes a lot of effort to re-navigate these systems, and talking through these systems is not able to access the subconscious within the brain, nor does it acknowledge the muscle memory. That's why when someone goes into a grocery store and they have a panic attack and they don't know why, it's because their body is remembering something. Their body has been distressed probably for a long time and they didn't know it. And the overstimulation heightens their nervous system and they have a panic attack. So acknowledging that we can rewire these systems should be the next phase of where the mental health field is going. That is why it's important to treat the whole person. Holistic care involves seeing the person as a whole in their contextual environment. So we're thinking that the environment expresses our genes, right? And we need to create a safe environment for people to heal, and we need to allow the body to express itself. This means understanding that the mind, body, spiritual aspects of healing are interwoven, and the ability to have the resources for that healing is accessible. A lot of times, the mind, body techniques are used upper middle class, or people are paying $25 to go to a yoga class, and marginalized people do not have the ability to afford that because of where they are in life. And it really segregates the ability to heal on a deeper level. This is why we are developing a wraparound system of treatment. And I'm going to get into a little bit about what our nonprofit is trying to do to like break into this way of treating trauma. My husband and I created a nonprofit on Cape Cod called Realize Truth Inc. about 2 years ago. It's still a startup nonprofit. It's a 501c3 nonprofit organization founded by local people supporting individuals through holistic trauma-informed care and education to foster resilience and connection for a healthier, more nurturing world. And our vision for Cape Cod is to be a place where trauma experienced by individuals and communities is holistically addressed, leading to empowered, resilient, and connected lives. So thinking back to those survival behaviors, can those survival behaviors become a resilient, empowered behavior, right? Can people transmute those aggressive tendencies to passion and drive and initiative? That's what we're hoping. We anticipate having a holistic wraparound service. On the left with the red bullet points, those are the things that we already have and we've set in place. I have a practice here on the Cape already in Hyannis, and we're grouping together with other therapists that support this trauma-informed lens and holistic ways of healing. So we have group therapy, individual trauma therapy, individual coaching, holistic services, art therapy, yoga therapy, music therapy, breath work, family services and workshops, community gatherings, educational seminars, cultural gatherings, and trainings for agencies and local providers. What we're hoping to have, excuse me, sorry, at some point is a homeopathic doctor, somebody that's specializes in herbs for people that want alternative ways of healing, a nurse practitioner to manage the psychotropic medication interventions for people that might want to titrate down as they're feeling more empowered, a physical therapist, acupuncturist, craniosacral therapy, neurobiofeedback, and nursing nutritional programs for people. I'm not going to delve into this theoretical framework too much, just in reference to time, but we really focus on polyvagal theory, incorporating ways to slow down the sympathetic nervous system in order to feel safe and be able to explore and socialize. And that's through mind-body techniques and a sense of community, which supports liberation psychology. People feel supported and they're going to feel empowered. Traditionally, when you go to a therapist, a psychologist, they're telling you what's wrong with you, they're giving you a diagnosis, and they're telling you you need to do this, this, and this. There might be other versions of that, you know, there might be a more person-centered approach to that treatment, but usually someone is going to a mental health professional to find out what's wrong with them and be told what is wrong. For our approach, we really want people to identify that there's nothing quote unquote wrong with them, and they have the ability to explore whatever stored emotions they have in the body. And the goal is to regulate the nervous system in order to create a new baseline within the body, process family trauma patterns, form a supportive community, and transform survival mechanisms into resiliency behaviors. And through my research, my doctoral research, I really identified a term called socio-ecological trauma lens. So that's incorporating the environment, the biology, everything that nature and nurture encompasses, and how trauma is incorporated through that. So that's thinking how the intergenerational and historical trauma have impacted a person when they walk through the door, right? Holistic care becomes an adjunct to the biomedical model. We're not trying to eliminate it. We're not trying to go against it. We're trying to say, you know what, there might be another way of healing here, and let's try this avenue for people. What would a Cape Cod healthcare patient outline look like if a person presents at the ER with acute symptoms due to recent trauma experiences? This would be the prevention phase. So they would essentially, meet with us and be referred to us and have specific services that are tailored to which phase that they're in. And if they're in an acute phase, they're not going to be recommended yoga therapy right away because it's such a vulnerable process. We're going to work on incorporating safety and regulation management. And then from there, you sort of open up into a more vulnerable space within the body. So an example of this, a patient presenting with acute symptoms due to a trauma experience. They come to the ER after experiencing domestic violence, sexual assault, car accident, arson, or another major traumatic event. They're assessed by the ED clinical, and they do not meet inpatient level of care. So they're not going on to a psychiatric hospital. And then, so that means they need resources in the community for their trauma. Left undone, they could continue to decompensate, and it will affect their family over time. And we want to catch things upstream, right? A patient with PTSD symptoms with and without high blood pressure, they might present to the Cape Cod healthcare system with depression, anxiety, panic attacks, bipolar disorder, psychotic disorder, ADD, ADHD. These are all indications of some kind of intergenerational or historical trauma symptom, right? So clinicians or physicians complete the PTSD screening and referral to us. We're going to have a link that will be a referral source for the electronic medical records platform. Clinicians, case managers, nurses will be able to give the patient the link to fill out the information, make the referral, and then they will have slots that they can pick for a therapist, a coach, or the groups that we have available, the holistic groups. So Realize Truth staff will follow up with clients the day after someone leaves the Cape Cod healthcare system or their appointment to establish a rapport and confirm their appointment. Take insurances, but it's notable we're a nonprofit because we do not want to turn anyone away. So funding for people that do not have insurance is there to ensure no one will be turned away and everyone can access mental health treatment. This is our space. It is still relatively underway, and we're just building up. Like I said, we're a startup nonprofit, but all the pieces are in place and we're moving forward. We're very happy about it. Why are we so passionate about this? We want to see people heal at the root, reach their full potential, and experience life with a sense of freedom. And this is where you can contact us if you want any information. My research is publicized on the website on Google Scholar if you want to read more in depth about things. And please feel free to connect with us anytime. Thank you.
Thank you, Raja.
Thank
My
you.
name is, I'm sorry, Dr. Guadagnoli.
I was just going to say thank you, Raja. Does anybody have any
Yeah.
questions? Please feel free to unmute. So I will.
I didn't know how to raise my hand, so
There you go.
I'm Dee Forrest. I'm the mental health nurse practitioner, and I'm executive director of the behavioral health service line for Cape Cod Healthcare. I am so touched by what you're trying to do here, and I'm very excited about how we might be able to kind of see how you. I oversee the psych emergency services teams in Hyannis and Falmouth. Of course, in concert with our executive directors in each of the emergency departments for, the same evaluations for the motor vehicle accidents, for all the medical. But the emotional part of it, and I mean, we could talk for a long time probably over the years that I've seen children come in with generational trauma, people who have lost parents but through the opioid crisis, and they're being raised by grandparents who lost their children to the opioid crisis, and just the continual, loss of all of that in kind of lost lives, even in the living. I would love to spend some more time with you and invite you to talk to our partial hospitalization group, our outpatient group. We just started an adolescent grief group in our outpatient, and I think you coming in and working with our clinicians, would be wonderful. And I also would love to see if maybe there's an opportunity for maybe someone to come in and do some breath work on our psych emergency services, on our inpatient unit, just to introduce people to what other things are possible. Medications are appropriate in certain areas. So is psychotherapy in different modalities, EMDR, so many other things that are available that we need to tap into, I think. So I'm so glad that I attended this, and if I could reach out to you after, love to see what we could do together with Cape Cod Healthcare. Thank you so much for doing what you're doing.
Thank you for being so appreciative and being here. Yeah, reach out and let's connect further.
I can also just make the connection by email. I think Dr. Sinjab's email is in the slide, but I can, after this talk, I'll just connect you both by email.
That would be wonderful. Thank you.
Thank you. There were a couple of thank you for the talks in the chat portion. Thanking you for a wonderful talk. Are there any other questions that anybody has, either through chat or you can unmute yourself too and ask the question? Well, thank you so much, Dr. Sinjab. That was definitely an excellent and informative talk. Really appreciate it. I'm wondering if you have any connection or have made any connections to Duffy Healthcare, cares for the homeless population here. And I know they also were talking about trauma-informed care. And it seems like the two of you and Duffy would be a good connection too.
I haven't connected with them specifically. We do work with Peer Recovery Center in Hyannis that has a lot of Duffy clients and people that are unhomed, right? And so hopefully we can continue to make those connections. If anyone knows those resources, feel free to email me and let me know.
Sure. Yeah, Don, that's a great idea. I think so. I think I still have the contacts there, and when I was the PHO, we worked more closely with the Duffy, or I will reach out to the PHO team and get Dr. Sinjab connected to Duffy. Also, I think there is plans to have Dr. Sinjab present to the PHO referring case managers as well, and the navigators, and hopefully in the pod meeting as well for the physicians coming down the pike. So I told Dr. Sinjab there's going to be more of these presentations coming up, hopefully. So
if you have any trouble with the connections to Duffy, just let me know. I'm on the board of Duffy now, so I can help you too.
oh, great.
Yeah, and Raja, also, we have Duffy come into on the inpatient unit weekly in order to do intake. So, and I'm working with them with Matt and Maud, and as well with their respite housing exploration that they're doing. Have you also, and you probably have already reached out to Independence House?
I haven't. I'm actually
I'm happy to introduce you. So I think that would be a great service if it works out.
okay. Great. I'm actually not from the Cape originally. My husband is, so I moved down here 2 years ago, and I'm building up my network down here. So any resources are welcome.
Are you familiar?
Well, we
with
will help you do that.
Thank you.
Are you familiar with Independence House?
Yeah, I am.
Okay.
Yes. Yeah.
Great.
Yes.
All right. Well, thank you very much. Great talk, and thank you all for attending.
Thanks so much,
Sinjab.
everyone.
Thank you.
Have a good evening.
Thanks, Don.
Thank you.
Bye-bye.
Thank you.